we've got a good number going here, so I want to go ahead and get started, be mindful of everyone's time. But really quick, before we get started with today's webinar, just a couple of housekeeping items to keep in mind. So this session will be recorded and it will be on the rater8 YouTube channel, and we will email a link to all registrants and attendees so that you can catch up on what you've missed. And we do encourage you to interact with the session today. So if you have any questions, feel free to utilize the question function at the bottom of your Zoom screen. If the panelists probably won't have time to answer at the moment, so we will save them for the end. But go ahead and as you think of them, put them in the Q&A at the bottom of your screen, and we'll answer them all at the end. With that said, let's just take a moment to introduce ourselves. So my name is Lauren Lawson. I'm the Solutions Marketing Manager here at rater8, and I'm really excited to get to host this today. And I just want to go around to our different panelists, and Amberly, we'll start with you if you want to give a quick introduction.
Sure. My name is Amberly Byington. I'm a physical therapist. I've been in practice for about 22 or 23 years. I see patients part-time, and then I also am a part-time practice administrator for an orthopedic and plastic surgery group in Lincoln, Nebraska. We also employ mid-levels and physical and occupational therapists.
Fantastic. Angela, you want to go next?
Sure. I'm Angie Stevenson. I'm the CEO at Indiana Hand to Shoulder Center. So we are a 12 surgeon upper extremity orthopedic group in Indianapolis, Indiana.
Awesome. And last but not least, Ron, Taylor's favorite person.
Hi, my name is Ron Chorzewski. I'm the CEO at Agility Orthopedics in Stoneham, Massachusetts. We have 8 physicians in physical and occupational therapy, and excited to be speaking with you all today.
Amazing. Well, let's get going. I'm really excited to see where this discussion takes us. So I want to start with a really kind of broad but simple question of, well, simple but not so simple, depending. But what are some of the biggest challenges that you all have faced in your own organizations around employee engagement?
I can jump in, Lauren, and say, I think one of the biggest barriers, the biggest hurdles is just kind of the perceived inertia or maybe the fear of employee engagement, because sometimes you don't know what's going to come from it. And sometimes if you've done it in the past and you haven't quite followed up on it as an administrative team, then the staff can have bad feelings about it. So there can be ancient history that comes back to haunt you in terms of employee engagement. So you can always start fresh, you can always start anew. I have found that the rater8 employee survey has been helpful for me to kind of get a baseline, get some objective data to build from. And I think it's important not just to do the survey and think that you're done, is that it's really just the start of the work. I've had success in meeting with the staff or the departments after the survey to kind of get clarification, and then try to engage in 4 to 6 action items between the survey and the next survey so that people have a sense of that you took it seriously and that you're actually followed through. So that's my input there.
Yeah, I will say, so to your question of the challenges of employee engagement, I think it's finding those meaningful activities or communications that actually can drive the engagement rather than just being a party planning committee or all the fun things that people want to do, and keeping also in mind the very tight budgetary constraints that we have of finding those free or low cost activities that actually can drive some of that engagement. Because otherwise, if people just want to have huge parties all the time, but we're not actually getting any ROI for that, and obviously very cost prohibitive to be able to do so. So trying to figure out what engagement really brings value and that you can also continue to do to where it's something that you can do long term, meaning not a once a year thing.
For us, as far as employee engagement, and this probably happens a lot of places, but you hear maybe mumblings or grumblings from staff, but you don't really know what's true, what's not, if it's a general consensus. Some people will speak up, some people speak up often, other people won't speak up at all. And so one thing that's been very helpful with the employee surveys is that since they are anonymous, and then we can talk more in detail about that, we have had a lot of good comments come from that. So both positive and constructive criticism. So I feel like we get more opinions because of the survey, the way the survey is administered.
Yeah, absolutely. All great points. That you can't just leave it at the survey. You have to take that next step and take action, and then figuring out what action makes the most sense to take, and where to go forward, and just having that objective data to draw upon. So it's great. Um, and same question, but regarding, talent acquisition. So what are the biggest challenges you faced in talent acquisition in your organizations?
I can go first. I mentioned this a little bit with the pregame show here with the other panelists, but Lincoln, Nebraska is a city of about 300,000 people, and we're about an hour away from Omaha, Nebraska, which has about 1 million people in the metro area. And over the years, when we are finding new providers, oftentimes they're from this area. Maybe they've taken other first-time jobs or other jobs, and they're coming back to their roots. So for us, that's been a barrier in, especially I think in recent years, but just with a lot of the shifts in healthcare and with inflation, of finding the providers. And then as far as staffing, just with trying to keep up with hospital pay and wages, it's pretty can be difficult for a private practice because the hospital system obviously is just a different type of entity. So those are some of our barriers here in Lincoln, Nebraska.
Yeah, I will say for us, it's actually getting responses. So we're doing the typical job postings and trying to find candidates, but we're not even getting the number of people to choose from as we used to in years past. So the pool is definitely much, much smaller. And something that I found that's been really interesting the last couple of years is I believe in a really good due diligence program for interviewing and recruiting. So I want to bring someone in, maybe do a phone screen first, bring someone in, even then set up a job shadow. I think it's important for that person to understand what they're going to be doing day to day and who they're going to be working with. So now we don't have the time. We're lucky if we get an interview scheduled, then we can't get them to show up for the interview. The no-show rate for interviews has been crazy high. Then they come in and they want a job offer on the spot. We're not particularly prepared to do that, but we've had to really escalate our process and some of our due diligence just because of the lack of candidates and the fact that, the minute they walk out of the office, they probably have 3 or 4 other offers if they didn't just come from an interview as well. So we've really been struggling with that piece and sort of had to, there's no longer like, you can't bring them back the next week for a job shadow. When they're here, they immediately go to the department and they spend a little bit of time, and then that's the end of it. So we've had to escalate our timing of things quite significantly.
I can add to that. I feel like just like in our prospective patients know a little bit about us before they come in if they pay attention to our online reviews. Potential employees have the opportunity to go and see your online reputation as well. So they can go to Indeed and read your reviews. If you haven't read the reviews for your organization, I encourage you to do that. It's because you have a score on Indeed and you have reviews on Indeed, and that can be a barrier, a serious barrier to your talent acquisition. So, it's a great place to look. It's a great place to pay attention to, and potentially even think about asking people when they leave your organization, if they're leaving for, pleasant reasons, like perhaps they'd think about going online and leaving a review for the practice, or even employees who are not leaving, they might be able to go on and leave a review for you as well.
Yeah, that's a really good point, Ron, of just speaking to the challenges that Amberly and Angie, you guys are facing with this dwindling talent pool and increased competition to acquire that talent. And I'm sure reviews is certainly one big piece of it. But also, I mean, have there been any sort of and I'm throwing this question at you, so bear with me, but have you taken any tactics as of yet, or are you still gathering information on how to be more competitive among that talent pool?
Well, I think sort of to my point of recognizing that we're not getting candidates, or when we do get them, we call them back a few days later and they've already accepted another offer. So we've adapted very quickly to that. Still, while trying to vet them out as much as possible, certainly pay is something we look at. It used to be maybe every other year we look at our salary grades and things and compare, but now we're doing it at least once a year. And even just this morning, we have an X-ray tech position that's open. It's been open for a long time. All of my colleagues in town are struggling with the same thing. And our salary grade just for our area was 19 to 34. And these candidates are demanding $40 an hour, and we are not going to get someone for $19 an hour. So even just this morning was, okay, we need to change the grade. We need to expand this. Let's see who we get and then make the evaluation from there. Because obviously we can't do without an X-ray tech. So being very quick and nimble to make changes like that, which I have the luxury of doing in a smaller private practice, allows us to at least attempt to keep up with the competition and the changes.
I think that the biggest champions for your practice are already in there, right? They're already employed by your practice. So if you can have your employees be your champions, that it's going to be a lot higher to recruit people in there. You know, I think I try to pay equal attention to not just patient satisfaction, but also the satisfaction of my providers and employee satisfaction. So if any two of those are happy, then the third group is going to be happy too. So just trying to focus my attention in all three areas is helpful in terms of talent acquisition.
Yeah, that's a great point of getting that holistic view for sure. And Angie, to your point, staying nimble and making the changes and not hesitating. So with all that in mind, I'm sure there are folks on the call or who are watching this later who resonate with these challenges that you're facing, who maybe haven't started the journey of, employee satisfaction surveys or an employee engagement program. So what motivated each of you to start this journey, and how did you get started?
I can go first. We've been using rater8 patient survey functionality for over 2 years, and I'm the main go-to for that. So I respond to all the reviews and monitor responses and ratings and all that, and all the data points. And so once the survey was offered, I was very familiar with the dashboard, and it was just very easy to kind of apply that knowledge to this new functionality. And also, we just needed to start surveying our employees on an anonymous way that I alluded to earlier. It's nice because it's anonymous for the staff, but the surveys are broken down into departments. And so you can get a feel for which departments maybe are a little more frustrated with than others. And so we have about 55 employees. And so if we have a couple disgruntled people that we already know about, sometimes we can figure out based on the department delineation, and we can kind of figure out maybe who those people are. And then also too, just giving light on comments that haven't been heard before from maybe departments that are a little bit quieter about what they're going to say. So it's been a huge help for us.
Yeah, similarly for me, we were doing old school Survey Monkey where we were paying for a subscription to that and then sending a link and hoping for the best. And really, you have some functionality with Survey Monkey, but it's just nowhere near as user-friendly as this platform, where they can do the star rating, they can leave a comment. The questions are already mostly laid out for you and are hitting all the points that you need to. So then, like Amberly said, the dashboard is so easy. So from some of the reporting piece where I can present back to the physicians, like, here's the star rating, but if you want to see an actual count, here's the numbers, here's the percentage of that. And we've seen our compliance of completing the survey go up because it is much more succinct than what we were doing manually with a Survey Monkey tool.
I can add that, I think when we think about some of the barriers to people or practices starting the rater8 surveys with patients, the same thing might happen with our employees, because we might be afraid of getting a bad review. We won't ask our patients because we're afraid of a bad review. But you know, we might be afraid to ask our employees because we might be afraid of what we might hear, right? So I think the motivation for me to get started with it was the fact that I just wanted to have a baseline. I wanted to have some objective data, know where I was, and from that, wherever I was, I could start to build on that, and I could start to make improvements. And as long as I was consistent in my message with the staff, then I think that they came on board too. And I think it's like, you know, wherever you are in the spectrum of improvement, you've got that objective data to help make you become a better employer. And it's just the process. It's an ongoing process, no matter how good you are.
Yeah, absolutely. And so, you know, a couple of you touched on this, that the surveys are fairly succinct. And we did try to keep it that way, to keep them short and flexible and customizable so that, you know, you all could adapt them to fit your own needs. Because there's no one size fits all when it comes to running a program like this or surveying your employees. You know, every practice is different. So with that in mind, what approach did each of you take, and how often are you surveying your employees? What cadence did you land on?
I think I've been using it maybe the longest, but we were doing every 6 months just because of the ease and the fact that initially speaking, we got enough feedback and more compliance from the prior tool that it was like, wow, there's a lot to attack here. So let's figure out what we want to attack. And then we want to remeasure it. I don't want to wait a year to see if we've done better. So we were doing it every 6 months, and then found as the things started to stabilize a little bit, but also you're seeing these trends that some you can't really adjust much at all, and others are, why are we waiting until the time of the survey to actually give that sort of feedback? It's such low hanging fruit to fix, that we went with a 9-month cadence, because we don't want to go a year, but 6 months is too much. We want to continue to see that employees want to fill these out and not get survey fatigue and things. So our sweet spot after a couple trial runs has been every 9 months. That also then allows you to hopefully capture new hires in a good window of, they've been here enough time that they've got a sense of how they can answer these questions, and not waiting too long after they've started.
From our perspective, we probably fall into a very similar pattern as Angie. So I try to do them every 6 months, but I don't think about it as much as a time period, as much as I think about maybe making sure that I've been responsive enough through in between surveys that the staff can understand that that there's enough being done. So if they do 2 surveys and really nothing's been done and they're just giving the same feedback, then I think even if the survey is super easy and fast to do, that they're going to be fatigued or bitter because no matter what I do, nothing's going to change. So I think the fact that I just want to make sure I get to a certain point where it's all right, we've done enough with the last survey that the staff can participate positively in the second survey. That's kind of my approach.
And for us, it's been about every 6 months. We try not to do it fourth quarter, so we do have one coming out here around October 1st. Fourth quarter is just always such a crazy time in healthcare, and so we want to make sure we get kind of people's opinions before that, and then also that gives us time to get through the rest of the year as a management team to push through and then help make some changes. One comment that I had here in my notes is that I think for us it worked out because our patients got used to being surveyed, and then our staff got used to the fact that patients were being surveyed. Then our providers got used to rater8 because they would get their monthly summaries, and then we actually then rolled out the employee satisfaction. And so it kind of for us was just this natural flow of what was coming next. So our staff became more and more familiar with rater8. And so maybe that helped, like the trust value of it. It wasn't just coming out of nowhere. I also too usually email all the staff within a week of when the survey is coming out, so they know it's not spam because they get dinged if they open spam. And so I give a heads up email wise just to all of our staff to let them know. And then kind of watch engagement and then encourage them if engagement is low to please respond. I just usually do that one follow-up email though, and then I leave it be. So that's kind of how we've structured it.
I love how mindful all of you were in starting this journey, because a lot of organizations, they send out an employee satisfaction survey and then it's, well, we checked the box. We don't have to do anything else. There's nothing to follow up on. And what you all spoke to is so true about employees. Another aspect of survey fatigue, where not just, filling them out constantly, but also filling them out feeling like nothing's been done. So I love that you spoke on that, and that you've all kept that in mind in setting your cadence and really meeting the employees where they are. That's fantastic. I'm curious, are there any, do any of you have specific initiatives you'd like to share, or anything that came out of those surveys, that action items that you have, completed or still in the journey of working on, that you'd like to share?
I can jump in with that. I think the theme that I have found with most of the surveys that we've done is people don't feel like they're communicated well with, they don't feel appreciated, or they don't feel like they know the other people in the organization. So we've tried to build some initiatives around that. So as we do some job shadowing. So we have one person from one department go sit with another person in another department, where maybe there's friction between the departments, and it's because they don't understand each other's roles as well. We've actually started this staff appreciation cart, because we try to do appreciation day like once a year or something like that, but we have an appreciation cart that's full of snacks and we push it around. So I love pushing it around, but we take turns with it. So so people from different departments take turns pushing it around, and that they get to meet everybody when they're going around, and some people like that and some people don't. We started to do some staff meetings, which sounds simple, right? It's really hard to do a full staff meeting in a practice, because the docs are running over with their schedules, and it's just hard to coordinate this to a couple different locations. So we've made a commitment to do that. And actually our first one is next month. I've just started back at this organization. So that's just one of the initiatives as well. And we have a newsletter as well that we try to do. We call it a staff update. And then I think one of the things that I learned a lot from these surveys was it wasn't at first, I kind of felt like, okay, they're going to be talking about me or the administrative team, but a lot of the feedback we got was not about kind of up the corporate food chain, but it was kind of like interaction and communication with other departments within the organization. So we've tried to just create opportunities for people to get to know each other.
That's great.
So for us, communication, that always comes up as well as a kind of common denominator of what we need to address. So last fall, we actually structured our company retreat. We did like a leave work at half day, and the retreat was actually about communication. So everything from nonverbal communication, education, to interpersonal. We did a bunch of different topics. So different administrators kind of presented to the group that day, and then we incorporate some just fun activities with the day as well. The newsletters, we started the newsletters as well for communication. And then something we did to kind of work on the interpersonal is we built a couple teams, had volunteers, I should say, of people from different departments, like our fun committee and our smart committee, to help with some patient interaction items, and then also too just for the social aspects of the fun committee. So all of that came from the feedback we got on the surveys.
Before we go to Angie, can you, Amberly, can you expand on the two committees, and especially around coming up with ideas for improving the patient experience as well as their own work life experience?
Well, we jovially named this the Smart People Committee. We wanted to figure out, as far as like a digital check-in process, how that would help the organization. So that was one thing that administrators wanted to kind of work on. But we also wanted the committees to come up with what they thought was important. We didn't want to just say, here is this task, how should we figure this out? We wanted kind of an open forum on some ideas. And so then we could form some action items and then kind of prioritize that from a management team perspective. So that was the smart people committee. And then the fun committee, like I said, was just more of the like holiday party, more like summer party for staff. So just different things where those people could help organize the food and the activities, and just give them some ownership with those tasks.
Great. That's great. Angie, I didn't know if you had anything to add. Sorry to interrupt before.
That's okay. I can. I was trying to think of the initiatives that came out of the survey. A lot of the things we had in place, but we found that the survey then just really helped accentuate them and possibly added to. So we had a newsletter. We had town hall meetings at least twice a year. I then used the town halls as a forum of, we're going to spend one of them specifically addressing the comments, concerns, questions, the overall ratings. I like to let everyone know, here's how we actually scored on these things. And here are the 2 that we didn't score as well as we thought we wanted to. And these are the areas of focus, and here's how we're going to do it. Other specific things, I read obviously every survey and every comment, and it would be the simplest things where I'm not waiting for the town hall. Someone said, laptops in therapy are just terrible, and they, can't pull the battery, can't do all these things, like very specific. And it was, we shouldn't have to wait for an employee survey, and that's not a group discussion anyways. Let's go have my IT guy, we start a project plan, we are going to replace these, and then they see that there's these action items, but it doesn't need to be something that everyone is participating in. Whereas communication and appreciation are 2 revolving topics that are typically lower on the score, and trying to figure out how to specifically address those both by individual departments and then as the company as a whole.
That's great. I love that these ideas really ran the whole spectrum from, improving, from more a social aspect of improving communication, improving just general life at work, making it more fun or more enjoyable, all the way to actual operational inefficiencies that were discovered that needed to be addressed, whether to improve the employee's experience or the patient's experience. So that's fantastic. Do any of you have any results as of yet of sort of how this turned out? Did you see any changes from these from implementing these changes, or are you still kind of in progress?
Well, my therapy department with new laptops is extremely happy.
I bet.
I mean, it is the little things, or something simple. Again, sometimes it boggles my mind of the things that people wait 6 to 9 to 12 months to tell us. Like, hey, we have creamer in the break room. Could we possibly get flavored creamer? Sure. If this is the little things in life that keeps everyone happy, very, very easy to do. So you can make these little small wins that hopefully are obviously impactful enough to leave on the survey. And then the other one that we've had is the interdepartment communication. So similar to what Ron said, we have 2 groups of people, the medical assistants and scheduling, always fighting. It's sort of like a front and back situation. And we did a sort of day in the life, not an entire day, but we obligated them to go and spend time with the other departments in a rotating type fashion, just to kind of figure out like, oh, I see, they're really not trying to intentionally screw my day up and put these patients on wherever they want to, or like, oh, I see how hard the MAs really are working. That's why they can't answer the phone when they're rooming patients, et cetera. So it really, and then we actually made them document their experience and give us the feedback so we could kind of learn what they were seeing. And that's been extremely helpful from the interdepartment conflict that we've seen for always those 2 departments in every office I've ever been in. I don't know why.
Yeah, that's really cool.
Yeah, so true. I think we have seen some improved relationships between departments, but I think I would just add that for some reason, fixed problems don't always stay fixed, right? So just like there's a problem, you did something, you fixed it, that it's going to rear its ugly head again. So it almost speaks to the need to just continually do the surveys on an ongoing basis so that you can understand when problems are creeping back, because the fixed problem doesn't always stay fixed.
Yeah, I mean, I agree. It's just a work in progress, and it's just the continual, management team checking back in, because a lot of times there's just patterns that repeat itself. And like Ron said, it may be fixed, but then it has to be modified or fixed again. So it's just the continuation of management.
Yeah, continuous listening, and I'm sure too, as you have maybe turnover or new employees, it may have been fixed with the other employees and it comes up again with new employees, or or just in general. So that, yeah, absolutely. Well, final question before we open it up to the audience. Just want to leave it with asking you what advice you would give to organizations that are just starting to focus on improving employee satisfaction in their own organizations.
I can go first. So I think just keeping perspective, I mentioned with the last question of just continuing to move forward, just understand that it's just part of leading people. It's part of managing people. It's part of serving people. You just have to keep moving forward. And there's always going to be people that are dissatisfied, whether it's patients, employees, providers. Comes some emotional intelligence comes in there. So just understanding the way people tick and just the different tendencies. And then kind of meeting different personalities, maybe with different styles of communication, different interventions. So yeah, keeping perspective.
Yeah, I think for us, it's don't be afraid of what you're going to learn. Just know that you are going to learn some things. It's likely not to be as personal as you think that it is. And, part of the job security that you have and the reason that you're in the role that you have is to try to solicit this feedback and then actually do something with it. So I know Ron and Amberly and I talked about this pre-call, but it was, don't think you have to fix everything, because there's going to be a lot. And there are still going to be your one or two people who are going to say the same thing every single time, no matter what you do. Might have a few bad apples in there, and really with it being organized by department, it's pretty easy to tell sometimes who those are. So you got to take it with a little bit of grain of salt. It's like I tell my physicians, they'll get this like one scathing review or 1 star, and but you have 400 that are 5 stars. So let's see how much we really want to focus on the one negative piece, if you don't think it's something that is consistent among multiple people. So I think just being open to the feedback, but knowing that you are not going to be able to fix everything. And similar to what Ron said, it's not a one-time deal at all.
And I would just add that, you do a survey, the survey's got questions, and then you get the feedback, you get answers. But then what ends up happening is now you have questions, right? So you don't fully understand the feedback that was given, and you need to learn more about it. So I think for it to be successful, and this is just my opinion, and I've done this with every survey I've done, is I've met with the individual departments after the survey just to ask some clarifying questions. That's like, so and ask for their ideas and what would be some good solutions to the problems, and then just try to be a good listener, right? So one of the things that I know is that if I'm defensive, I can't learn. So I just try to turn off any defensiveness and say, well, we did that because of this and then this and that. So I just try to just listen and learn and not be defensive, and then try to incorporate the ideas from the staff as much as possible.
That was all such great advice. I'm going to see if I can recap it. We had, don't be afraid, keep perspective, don't try to fix everything, continuously and actively listen, and be open and remain curious. Those were 5 great starting tips. Those were great. Well, thank you all so much. I really appreciate it. I do want to open it up for questions. It looks like we have one here. So this person is asking, said earlier, one of you mentioned that you try to run surveys at a time that will allow you to capture feedback from new hires. Has this helped reduce early turnover? And how else do you ensure that new hires feel supported and engaged from day one? I think that might have been you, Angie, that
I
mentioned.
know, was that me that said that?
that.
Yep, I'm sure it was. So I think we talked about this on our pre-call as well from a new hire standpoint, and Ron and I think had some similar things where we assign them a buddy. So they have a buddy, they have a training checklist, they have a meet the department heads, they have to go around and meet everyone. We always do an orientation within the first 30 days. And we try to have it more than one person. So we do that orientation. It's where all of the department heads come through, introduce themselves, their roles, and how that person will interact. Because similar for you all, I'm sure, there are times like therapists might never ever talk to an x-ray tech, or medical records isn't really talking to I don't know, someone in logistics, but so we do those things. I think that from an early turnover standpoint, I haven't done any actual stats to see if that has helped. But I think just knowing that they're heard and then having that system up front to where they feel like they're being helped along. You don't put them in their office and then day two say, let me know if you need anything and don't check in with them. Also, from a new hire perspective, my managers are expected to meet with their new employees every week for at least a month, and then go to every other week and have that consistent touch base, just to even check in. It can be 5 minutes, issues, training, communication, just anything they want to talk about at that point.
That was great. Did anyone else have anything to add before we go to the next?
We just do a little like a monthly newsletter, and so if there's new staff, I just ask for a quick bio from them. So I usually send like a previous month's newsletter as an example, and then kind of just a welcome new staff member, so then all of our staff get that newsletter at the same time to their inbox, and they can meet that person, at least get to know them a little bit in that sense.
I almost wish I could be a new employee in my organization, because I just feel like that I am a new employee, but the truth is that when you're like, if you're a medical assistant, all the other medical assistants tell you what it's like to work there. It's like, don't even bother. Nothing ever changes here. Those are the type of messages that immediately start the internal brand for what it's like to work there. And if the message they get is, something, they do a survey and they've been fairly responsive. So maybe you could share that on the next survey. It was like, oh, okay, well, maybe it's not. This is a good place to work. It kind of reaffirms they're in the right place, as opposed to some of those other messages that they can get.
Yeah, that's a really good point, that, your reputation as a company, as an employer, doesn't just stop after the person is hired. It continues on. It's not just what they find online, but also what they experience in their first, week, month, quarter. So that's a really good point. So the next question says, what was your biggest roadblock, if any, when implementing employee satisfaction surveys? For example, did you get any pushback from leadership team members? Or pushback from anyone?
I get more pushback after the results come out. But no, because also too, like, they're expected to complete the survey. Just because you're in management or leadership doesn't mean that you don't have feedback to give from potentially how things could be done differently or better, or just issues that you may have. So no, I think it's a cultural thing as well. And it does also probably need to start even higher than that with the physicians. So I know when we get our results, my physicians and management team get the information separately, but at the same time. So everyone is seeing everything, including all comments, no matter how harsh they may seem. And I think that sort of open communication is very important. And then it just becomes part of the fact that you're going to do this every 6 to 12 months, and then you're going to deal with the responses.
I think the pushback that you're talking about in the question is really just the fear of doing the survey in the first place. And I think once you have the starting point, it's like, yeah, I want to do the next survey. I want to see if I improved, because we did like 3 or 4 or 5 different things. Like what impact did it have on the staff? And then to do the survey and see that you went up. I guess I initially theoretically thought our surveys scores were going to improve more significantly than they did, but they improved every time, right? So with a 1/10 of a point and 2/10 of a point is actually a big improvement. Because if you do that every 6 months, and then in a year or two, you're going to have some significant score improvements. And you can benchmark yourself to other practices, right? So that's super cool. You can do that with the patient satisfaction, but you can also do it with the employee satisfaction to see where, like, oh, I think I'm a good employer, but look at the scores and be like, oh, I got a little work to do.
Yeah, that's a great point. That benchmarking can give you some good context for where you sit. Might be doing better than you think. So the last question I think is kind of for me. So it says, what questions are available on rater8's employee satisfactions surveys? So let me see. So we have the following. We have 7 questions available that are sort of our benchmarkable questions. You can always add custom questions, but they won't have as much data around them for the benchmark. The questions we have is, does communication meet your expectation? I feel like my work is appreciated. And I should say all of these they rate 1 to 5 stars, and they have the option to add a comment. So you get both the quantitative and the qualitative data. So does communication meet your expectation? I feel like my work is appreciated. Likelihood of referring this employer to family/friends. My coworkers are friendly. Staff members are willing to help each other. The management team cares about their employees. And what would you change at our organization? And so those are the questions, our core set of questions. And then, of course, if you need to ask something specific, you can. Okay, another question is, it says, for the panelists, is it possible to get ahead of burnout? Not an easy question they're throwing at you. What do you think? Do you think it's doable?
I think it is. I'm an optimist, but I say definitely, enthusiastically yes. And I think it's really just about culture. I think in the PT world, you say, to avoid an injury, look at pain and fatigue, or just look at discomfort, before it turns into a pain. It's like the survey gives you the opportunity to look at micro problems before they become huge problems. And just to know that they're there and address them. So I think I would say enthusiastically yes.
I am not an optimist, but I would say I do think it's possible to get in front of it, but it's going to be sort of staged of, you have to be able to recognize the either very early or pre-burnout. And as a leader or manager, can you recognize that and then figure out for that individual what they're going to need? I think what I've seen is try this, like this one size fits all. And I was recently at this conference and they said, well, how do you manage stress? I mean, why does it matter how I manage stress? We got to figure out how you need to manage your stress, because me telling you what works for me is not necessarily going to work for you. Same thing from a burnout perspective. It's like very differing levels of what it's going to take to get that person burnt out, but then also how you affect it. So smaller organizations, it's a little bit easier with a number of people, them, you can kind of recognize there's something a little bit off with them. And it's not only your job to do so. So it's imploring your managers to be kind of on the lookout. But even as not an optimist, Ron, I would say, yes, I would agree. You can get in front of it.
I love that answer.
I do think it takes a tremendous amount of effort. One example that I could give is being a smaller group, so 50 employees. I'm just trying to figure out if there's something that kind of, what do you call it, like a repeat, like the broken record, right? It's just repeating. What bigger change maybe needs to happen that might be kind of painful for people, but in the end, the force, looking ahead in the future thinking, you just hope that, and you know it's going to be better. So one thing that we're shifting to is more of like a physician siloed like team approach for scheduling and MA and rad tech, and we've been able to kind of float people, but we sensed over time that that actually was stressing people out the bigger we got. And so it's a big change for everybody, but we are willing to kind of roll with it because we really hope and believe that it's going to be in the end better, and it's going to be better for future providers that join us. Like I said, and every organization has its own culture, its own pulse, and so identifying that and being part of that, so you can figure out what systems are going to work best for your people.
Yeah, absolutely. And the person who asked the question said, I appreciate the different perspectives. Thank you so much for sharing. And I agree, it's good to get perspectives from all around the optimism spectrum. Well, thank you all so much. I think that's the end of our questions. If anyone has any others, get them in now. But just as a reminder, this was being recorded and will be sent to you. And I just want to thank all of our panelists so much. You all gave such great advice, some great starting recommendations for people who are just thinking about doing this, and just practical tactics to take as they go about this. And it was so lovely to hear each of you share your perspectives. And for anyone out there that is looking to get this started, we do offer, employee satisfaction here at rater8. And you can always reach out to learn more. But thank you all so much. You all were fantastic.
Thank you, Lauren.
Awesome.
Thank you.
Thank you.
Have a great afternoon, everyone.